Central sleep apnea (CSA) is due to lack of respiratory drive during sleep, causing inadequate ventilation. A rare congenital form known as congenital central hypoventilation syndrome (CCHS) has been called Ondine's curse. Though central sleep apnea is rare, it is frequently associated with heart failure, atrial fibrillation, and stroke. The remedé system is an implantable phrenic nerve stimulation system. Transvenous phrenic nerve stimulation causes diaphragmatic contraction similar to normal breathing. The remedé system pivotal trial randomized 151 patients across 3 countries in 31 hospitals. Patients had apnea-hypopnea index AHI of at least 20 events per hour as documented by polysomnography. All patients were implanted with device and randomly assigned in 1:1 ratio to either stimulation or no stimulation for a period of 6 months. 35 patients assigned to stimulation had a reduction of AHI of 50% or more at 6 months. The corresponding number in the control group was 8. P-value less than 0.0001. There was concordant improvement in oxygenation and quality of life. 7 patients died unrelated to implant system or therapy. 2 each occurred in the treatment and control groups during the 6-month randomization period. 3 deaths occurred between 6 months to 12 months period when all patients received neurostimulation. 27 patients in the treatment group had non-serious therapy-related discomfort, of which 26 had resolution on simple system reprogramming, while 1 was unresolved. The device was approved by FDA in 2017. A prior pilot study in 57 patients was reported in 2015. The remedé pulse generator is similar in size and appearance to a standard pacemaker. It is implanted in the right or left pectoral region. It uses a transvenous lead implanted in either the left pericardiophonic or right brachiocephalic vein to provide stimulation to the adjacent phrenic nerve. Respiration is sensed by either the stimulation lead or another lead implanted in the azygos vein. This pilot study achieved its primary endpoint, demonstrating 55% reduction in apnea-hypopnea index from baseline at 3 months. 5-year follow-up of the remedé system pivotal trial mandated by FDA was published in 2021. 52 of the original 151 patients completed the 5-year follow-up. The study documented sustained improvement in apnea-hypopnea index, central apnea index, arousal index, oxygen desaturation index, and sleep architecture. The Epworth Sleepiness Scale (ESS) had a median reduction of 3 points at 5 years, which was statistically significant. 16 patients underwent pulse generator reposition or lead revision primarily in the first year. No unanticipated adverse device effects or related deaths occurred throughout the 5-year period. A sub-study evaluated the interaction with concomitant cardiovascular implantable electronic devices (CIEDs). 64 of the 151 patients had concomitant CIED. 4 CIED oversensing events were noted in 3 patients, which led to 1 inappropriate defibrillator shock and delivery of anti-tachycardia pacing. The presence of CIED did not seem to impact implant metrics, implantation success, and efficacy of transvenous phrenic nerve pacing. They suggested following a detailed interaction protocol to minimize the occurrence of device-device interaction. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video.